AKI is a condition of the kidney when there is a rapid injury to the kidney that happens within 7 days. This damage could be to the vessels or to the tubules or the interstitium, as we'll see in a bit. As a result of decreased kidney function, there is going to be an accumulation of nitrogenous and other metabolic toxins inside the plasma, which will lead to an increased serum creatinine, a decrease in the urine output, and GFR. This is the main symptom here. Also, the kidney cannot perform its function of maintaining circulating volume and even the acid-base composition of the plasma. So, decreased urine output could be because of so many conditions. It could be before the kidney, wherein we have low volume conditions in general, or it could be because of certain drugs that directly harm the system called the JGA, the juxtaglomerular apparatus, which actually controls the blood flow in the kidney and in the body. Renal autoregulation is lost. We can have post-renal causes, which are mainly obstruction of the bladder or a pelvourethral outlet, and intrinsic causes. For example, if you see these small vessels over here, you have the afferent arteriole, the glomerular tuft of capillaries, and the efferent arteriole. If because of some atheroemboli or hypertension or vasculitis or sepsis or DIC or TTP, HUS, hemolytic uremic syndrome, any of these cause an obstruction or a narrowing of these vessels, there is going to be ischemia and there is going to be damage and destruction. Spoke about small vessels, we'll talk about the large vessels as well. We have the renal artery, the renal vein, and abdominal veins. If something blocks the renal artery, we have a direct ischemia, and if something blocks the renal vein, if there is renal vein thrombosis, that is going to lead to backflow and congestion, and ultimately there's going to be pressure around the vessel and again decreased perfusion. We take a cross section through this tubular area. The tubular tissue per se, the epithelium, can be damaged by toxins produced by the body itself in cases of crush injury or seizures or immobility because of abnormal muscle activity, or in cases of hemolysis wherein there has been a recent history of blood transfusion, etc. Or there could be exogenous damage inducing toxins like contrast media or cisplatin, which is a chemotherapy agent, and gentamicin. Again, ischemia and sepsis could also directly damage the tubules. Inside the tubules could also be damaged by endogenous toxins like myeloma proteins in a condition called tumor lysis syndrome, which could happen as a result of uric acid injury, or it could be because of chemotherapy also. And exogenous toxins include antivirals and methotrexate. Then we look at the space, that is the interstitium between the tubules, could be damaged because of allergic reactions to penicillin, PPIs, etc. Definitely infections and inflammation is also going to damage the interstitium. Or we could have infiltrative causes like blood cancers. Also, just to orient you, these are the small vessels like I told you. They go into the glomerular capillaries, right? This is the glomerulus. We have the PCT, goes down as a loop of Henle. This is the descending, and then we have the ascending limb. And then we have the DCT, goes down as the collecting duct. This is the outer part, which is in the cortex. And we have the outer part of the medulla. And then we have the inner part of the medulla, collects into the minor calycis, major calycis, goes into the renal pelvis, then the bladder, then the urethra, and out into your toilet. General management approach would include correcting any problems in the systemic and renal hemodynamics. You could do that with IV fluids, or you could do it with fluid restriction, or with diuretics and ultrafiltration also. You may use vasopressors and eliminate the offending agent if any.